With over 300 million prescriptions being prescribed in Australia alone, in today's episode of Dr. Noor, I take you through everything you need to know to keep yourself safe when taking prescribed medications. As a general practitioner, I see patients day in, day out coming into me for a diagnosis, for a management plan, and perhaps even at the end of it, they'll get a prescription as well. But have you ever thought to think of yourself and look at all the medicines you have in your cupboard and think, what are these actually for? Well, in today's episode, I'm going to give you a whirlwind journey of how to keep yourself safe when taking medication. Because let's face it, if you don't know why you're taking the medicine or how to take the medicine, then surely you're not doing it safely. First up, you've just been prescribed a medication by your doctor. Now, how many of you out there think about the medicine you've been prescribed? It might be an antibiotic, or it might be a new blood pressure tablet, for example. Who out there says, you know what does it actually do? Or what side effects will it have on me? And hopefully this juice of you out there will say, yep, I do that all the time. I always ask my doctor, hey doc, if I take this medicine, what's going to happen to me? But there are a small minority of people who just simply don't do that. And these patients that I see on a fairly regularish basis, and generally they tend to be patients who might be presenting new to myself, and we'll go through all of their medicines and we'll have a look at all of their medication list and we'll go through them one by one, and I'll ask the patient, what are you taking this medicine for? And sometimes they'll just look at me and say, well, I'm not sure, doc. My other doctor gave it to me. Well, when did you start it? Well, I've been having that for a few years now, but I'm really not sure what it's for. And it's this that I really want to avoid with you guys. I want you all to be savvy about what medicines you're taking, how to take them, and make sure you take them correctly, because we want to avoid that situation where you're being given a medication and you just simply don't ask why you're on it and how long you should be on it for. So going back to your new medicine that you've just been prescribed, take a moment to think about, what is this medicine actually for? Now, as a rule of thumb, I often go through with my patients every time I give them a new medication, and we go through what the medicine is for, because let's face it, if you don't know why you're taking a medicine, then the likelihood of you actually taking this medicine is actually going to go down. Your compliance is going to be reduced. So have a think about why you're taking this medication. Is it a new medicine that's going to be for a long time? Is it, for example, a thyroid medication? And generally these medicines have to be long-term in nature. They're usually lifelong. Think about, is it just a short-term medicine? Does your doctor just want to see how you feel after taking this antibiotic script? Are you supposed to go back in a few weeks' time to see what's happened? If these are questions that you don't usually ask your doctor, then I would recommend that you ask them, unless of course your doctor is super savvy and they go through these things with yourself. It's really important to find out why you're taking them, what the condition is for, and what impact will it have on you. So for example, when we look at antidepressant medications, they are designed to obviously make you feel happier in yourself, and they should be reducing the symptoms of, say, anxiety or depression, depending on which option you go for. But if you're taking this medication and you don't think that anything's really happening and there's been no progress, then surely you need to find out from your doctor, well, hey doc, how long am I supposed to wait for? Do I need to take this for, say, a year before I notice an improvement, or is it a much shorter duration? So hopefully when you've been prescribed a new medicine, or even just an old medication that's a repeat prescription, your doctor will go through with you how long they want you to be on this medicine for. Typically, take for example antibiotics, they may be a week's worth of an antibiotic, and your doctor might give you a packet of 20 or a packet of 21 tablets just to take, depending on what antibiotic it is, but they'll expect you to take it for 1 week. However, there are some antibiotics out there that aren't surely for 1 week. They may be a little bit shorter, for example 3 to 5 days, or there are even antibiotics that are just a 1-day course. So it's super important to get these fine details from your doctor before you take any medication. Conversely to this, your doctor might want you to be on those antidepressant pills for a period of time, and this could be, say, 6 months in duration or even a year in duration. And so making sure you know exactly how long they want you to be on those medicines for is also really important to keep your expectations up and to understand why you're taking this medicine and for how long I should be taking this before I feel better and before I notice some changes. Now, hopefully your doctor will go through that with you, but it is super important that, say, for example, you have been prescribed those antidepressant tablets, when will they actually start to take effect? Typically, most antidepressants can take a few weeks for them to start showing up their effects. And so if you weren't told that information when you're given your prescription, then you might be taking them after day 1, day 2, and think, oh, these just don't work. These just aren't working for me. I'm going to chuck them out. But that is actually the wrong thing to do. But however, if your doctor tells you that, hey, patient, it might take you a week or 2 before you start seeing some changes, then hopefully that will increase your compliance rate of the medication. Then it's time to move on to the side effects of the medication. So you've just been given this piece of paper that says to take these medicines for 1 week because your doctor's been super astute and has told you how long to take them for and how many times a day to take them for as well. Remember, that's super important to know how often you should be taking these medications. You should also inquire about the predicted side effects of the medication. Now, generally speaking, hopefully, fingers crossed, most doctors out there will go through the side effects that are expected for a particular medication. And this is really important, I have to say, because say, for example, you start taking your antibiotics, and let's face it, some antibiotics can really upset your stomach and they can give you symptoms like diarrhea. But say you didn't know that information, and say you took this antibiotic and then suddenly you got really bad runs, and you think to yourself, my gosh, this medicine is not making me feel better at all. I'm just going to stop taking it. But if your doctor had told you before in advance that it gives you, a bit of a bad tummy, then maybe you'll be more inclined to take it, and you'll be finishing off your course of antibiotics and hence treating your underlying infection. So it's also really important to make sure that you understand what the side effect profile is of a particular medication. And for example, conversely from that, if you do take the antibiotic and it causes you to have a really widespread rash, then that is a side effect that is not desirable. In fact, that is an opportunity for you to think to yourself, well, hey, the doctor told me that's a bad reaction, and if that does happen, then I should stop taking the medication. And so having an idea about what to expect in common situations versus what to expect in rare situations is really important when you are taking any new medication, or even a medication that might have changed slightly from your previous prescription. One other tip that I would recommend for you guys if you are starting a new medication is to arrange for follow-up with your doctor. Now, as I said, I generally do this with all my patients when they're starting a new medication, but it's called safety netting. So as doctors, or good doctors, we like to make sure that patients have got an adequate safety net, which means that if things don't quite go right, then that's the time to come in to see us. For example, if there are any red flags, or if, for example, that medication hasn't worked after X amount of period of time, come and see us again. And that's a really good opportunity for you to make sure that you have got that safety net or that follow-up option with your doctor or your medical practitioner to say, you know what, if this doesn't work, can I come back and see you in X amount of weeks' time? Because very often some medicines just take that bit extra for them to work. Taking that antidepressant example again, it can take a few weeks for it to kick into effect. So having that nice follow-up appointment with your doctor, say 2 or 3 weeks down the line, will give you an opportunity to revisit that medication with your doctor and decide if that is the right medicine for you to continue on with. And it's not just antidepressants that can take time. Sometimes blood pressure medicines can also take a few weeks for them to start working as well. So with all of your medications, whether it's a new medicine or even if it's an old medicine, it's really important to have regular checkups with your doctor to make sure that that medicine is doing what it should be for you. Okay, so now that you've finished your consultation with your doctor and you've got that lovely sheet of paper with your prescription on it, you know exactly what it does, what it's used for, how to take it, how many times a day to take it, what the side effects are, and what happens if things go really wrong, and also you've got that follow-up booked in, you take it to your pharmacy, and naturally you'll go to your local pharmacy and you'll give the prescription in to your chemist and you'll say, yep, give me one of these medicines, please. Well, here are my tips to keep you safe with the pharmacy, because let's face it, each step of the way there are some little booby traps that can happen, and certainly humans are humans and errors can happen, as happened in my situation with a personal story that I'm going to share with you guys right now. The other day I went to the chemist and I handed in an antibiotic script for some eardrops, and I took the medication home, and generally medicines are wrapped up by the chemist. They usually put them in a concealed bag with a bit of tape on the top, and you take it home, then you unbox them and you use the medicines. I realised that, shock horror, the medicine was 3 months expired. Now, this isn't something that is out of the ordinary. Actually, in fact, APRA, which is the medical regulatory body for pharmacists and medical practitioners in Australia, alongside the Board of Pharmacy in Australia, have actually released a statement advising their pharmacists to make sure that they're adhering to the good dispensing guidelines that they have written on the internet for them, because actually they realised that since 2014, well, it's the earliest record that I can see of it, there have been consistent issues or complaints from patients who are being dispensed expired medications. And what does this mean for you guys out there? Well, let's face it, if you're taking medicine that's expired, one, it may not be working as well as it should be because it's out of date. It might not be working well. And two, it might have some really untoward side effects on yourself that you're just not expecting. Naturally, it is the pharmacist's responsibility to check their medication before they dispense it to you, as I mentioned earlier with regards to their good dispensing guidelines. But as you can see, this isn't something that necessarily is unheard of. Now, it can happen. And so I do advise all my patients that when you do receive a medication from the pharmacy, do a couple of pointers for yourself. Make sure that you check the expiry date before you leave the chemist. They should be doing this for you, and they should be checking that your name is correct, your dosage is correct, and the actual medicine is correct as well. But just make sure that you do that double checking for yourself, because nobody wants to use an expired medication. Not only should you be checking the expiry of the medication, but just check that the label is correct. Make sure it's got your name on it. Make sure that it has the correct dosage of it. So your doctor will have told you, hopefully during the consultation, hey patient, I want you to take this antibiotic 3 times a day. Now, if you go to see your medicine and it says twice a day, well then you can ask your pharmacist and say, well, hey, my doctor said it was 3 times a day. Why have you written it's only twice a day? And sometimes this can happen in situations where you've had a discussion with your doctor and they want you to take a medication specifically at a number of dosages. Now, this might be a conversation that you're privy with your doctor, but the pharmacist is not aware of that conversation you've had. And so what will happen is they'll default back into their regular prescribing of this medication and they'll ask you to take it as a default. But really, they should be copying what the doctor has said. But sometimes, in some situations, I have seen this occur where I've had a conversation with a patient and I'd only want them to take the antibiotic or the medication a certain number of days, but because the pharmacist hasn't had that conversation with the patient or the doctor, they just go back to the default prescription of that dosage. So it's really important to make sure that on the label you check how many times a day you're taking that medication for and how long you'll be taking it to. And what I see commonly is that the number of tablets within your box doesn't necessarily reflect the number of days you should be taking that medication. Now, this is because sometimes some medications, for example, will come generically in a box of 30, say, but you only need to take 21 tablets as a course of an antibiotic, and usually there'll be some left over to spare. Now, often I see this in patients is that they'll say, well, I finished the whole box, rather than finishing the whole 7 days, for example, they finished the whole box. And so they're actually taking accidentally more medicines than they should be. So it's super important to make sure that, going back to your previous conversation with your doctor, that you know how many days you're taking this medication for, and knowing that sometimes there may be an excess amount of tablets in your box, in which case you can just discard those and throw them away. Another really important tip that I have for you guys is to read the package insert. If you haven't taken anything away from your doctor and it's all been a bit of a fuzzle and you can't remember what they said or how to take the medication, well, one, you should really call the doctor again and get that information for them. But two, you could also ask the pharmacist. And thirdly, you can also check with the package insert, because within the insert itself, it does tell you what the medication is for, how to take the medication, and what side effects to expect too. So hopefully by reading the package insert, it'll give you an idea of refreshing your memory from what the doctor has told you. One more thing that I just want to add in is, if you're not necessarily getting your medicines from the pharmacy and say you're getting some cold and flu tablets, say from the supermarket, just check the box has not been tampered with. Now, there have been so many times where I've gone to the supermarket and picked up some really inconspicuous medications like cold and flu tablets. And I've had a look inside and actually some of the sachets are missing because someone's sneakily taken out one or two of the sachets or a sheet of medications. So it's super important that if you are getting medicines just over the counter from the shelf, for example, make sure that you have a look at the box itself, make sure that it hasn't been tampered with, count the number of tablets that are supposed to be inside it and compare it with what the box says on the outside as well. Have a look and just see that nobody's tampered with it. Goodness, you don't know what people are thinking of their minds. They might be doing something nasty to your medications, but just be a little bit savvy with your medicines that you could be buying from your shelf. Okay, so now that you've got your medicine and it hasn't been tampered with, it's got all of the correct information on it, the dosage is correct, your name is correct, it's not out of date, it's within date, and everything's looking really happy, it is time to take your medication. Just a few points here for you guys to consider to make sure that you're continuing to take your medication safely is to check the timing that you should be taking your medication. For example, the contraceptive pill, which is the progesterone only pill, is very strict in its timing. It has to be taken within, say, usually a 3-hour window period each day. So make sure if you do have medication like that, you are taking as instructed as per the timing, because if you don't take it in that window period, then it may not be effective, and that causes knock-on effects in the future. So there you have it, guys. I've taken you through a whirlwind tour of how to keep yourself safe when you're taking medications, from the conversation with your doctor to checking the medicines with your pharmacist and to finally taking them at home. I hope you guys have enjoyed this video and found it useful. And of course, if you have any questions or comments, please don't hesitate to drop me a line in the comment section below. But for now, take care and stay healthy.